often do you find yourself thinking about the decisions you make and their effect on your health? If you're anything like me or my friends, it's a rare moment. That wasn't until I started attending Texas A&M University and became a health education major. This program is one of the top programs in the nation. Most of my professors are leading researchers in the field with multiple publications and government projects. Health education is a profession that is new to the career world and is finding its way into many different institutions and professional programs. My dream is to hold a career in health education and communication, specifically in a physician's office or a hospital setting. But because this is a growing profession, I hope to share a little bit about what the career is in health education and how everyone takes part in the process, maybe without even knowing it. Before I share with you what health education is, I wanted to give a quick definition about health itself. According to the World Health Organization, health is a state of complete physical, mental, and social well-being and not merely the absence of disease or infirmity. Obviously, health is something that we all as individuals have a responsibility to maintain. As health educators, we act as the supporters and cheerleaders to help individuals make the right decisions. Health educators in any combination of learning experiences designed to help individuals and communities improve their health by increasing their knowledge or influencing their attitudes. This definition is also from the World Health Organization. However, there are many different definitions about what a health educator is and the roles that they may partake in. If we think back to the WHO's definition of health, we see that health is actually an all-inclusive term, which means that it's much more than just teaching individuals about things that affect your bodily health. It includes the mental well-being, which could include depression, anxiety, or other psychological disorders, but also, where most people forget that health educators can have an impact, is your social well-being. Educators can help foster healthy relationships between family and friends, and teach young children the importance of healthy interaction between their peers. One example I like to use in explaining the process of health education is the information surrounding the use of tobacco, especially smoking cigarettes. Most of us know that smoking cigarettes is a dangerous recreational activity with respect to your health. The CDC has reported that 1 in every 5 deaths can be traced back to tobacco use. It has been known that to cause a variety of cancers, including kidneys, lungs, and cervical cancer, infertility, and heart disease. Despite all of these negative effects, smoking is still something we see in everyday activity. In 1946, the first Surgeon General's warning was placed on a box of cigarettes. This was the first part of the government's attempt to use education to affect public health. The statistics do show that, in fact, the numbers of smokers decreased after the first label was placed on the box. After that, with each new label and more information placed on that label, the sales of cigarettes decreased continually. To me, this is a clear example about the power of health education. We all know that on some level, the making decisions that are detrimental to the health is dangerous, but with more information provided with these subjects, hopefully we will see better decisions being made. This is why health education has been an important role in the health field. I have a passion for health education, which means my dream career would be working in a hospital or physician's office and develop health education and communication programs. Educators can work in a variety of settings, which include hospitals, nonprofit organizations, government, doctor's offices, private businesses, and colleges. With each new setting comes a new population whose health education needs need to be tailored to. According to the National Commission of Health Education Credentialing, there are 7 areas of responsibility for a health educator to abide by. So no matter what setting a health educator may work in, these 7 areas will guide all of their work and their goals with each program. These things can include things as research, program implementation, and a needs assessment. Like I said previously, my dream job is to work in a private physician's office, focusing on starting a health education program with a focus in health communication as marketing programs. Marketing in a physician's office is critical for the physician and the potential patient. The patient should know that there is a physician in the area in which can care for his or her needs and what is expected for them and the patients. Even though marketing may be considered more of a business aspect of the practice, a health educator has more success in this area because of their training in communicating with patients. Health communication is about communicating with patients about new programs that could help improve their health. For example, a weight loss program for someone who is overweight or even a diabetic. It also consists of reaching out and finding patients in the area outside of the office With new tools such as social media, this job becomes easier for a health educator. As a dream career, this is something I feel that I can accomplish. I hope that I shared just a little bit about what health education actually is and how we all partake in the process.